Although human capital development, which includes sectors such as health, education and gender, has been allocated 18% of the total resource envelope for financial year 2022-2023, the civil society budget advocacy group and other CSOs are still skeptical with government's commitment to resource this sector that is critical to the welfare of citizens.
That 18% in human capital development, you go deeper to ask, what's the quality of this money and where is it going? As we've highlighted, despite that lion's share, we are seeing a number of glaring areas. One of them was the recent, for example, national ambulance system. We know as a country we have a national ambulance system. However, we've noted that this is really underfunded greatly. We've seen there's a funding gap of this, close almost to 1 billion shillings, and the main area that we're asking for is at least the operation and maintenance of this system. Yes, the ambulances have been bought, for example, but there's no funding, ample funding to maintain them.
Ministry of Gender may not be in position to make enough noise to get more financing around community mobilization. So it is one thing that we have to take up as civil society, to engage, the people who communicate to all the people who are in charge of doing allocations, to these sectors, to see to it that the issue of community mobilization, if it is one of the mandate of Ministry of Gender, that they allocate more financing to that component.
During the engagement with members of parliament on budgetary funding for the health, education and gender sectors, the budget activists implored government to pay much attention to inspection of service delivery and make appropriate allocations to realize returns on this funding.
School inspections and monitoring. We know that to improve the quality of education within any given country is to monitor how it's working. The function of school monitoring and inspection is one that ensures that the quality of education is at the desired standard. However, in the current budget, we are seeing inadequate allocations to this component, especially in the local governments. So these are some of the areas that if you interrogate further, you will find that whereas it has been given, a big component has just been going to wage maybe. If you ask and interrogate what's trickling down to the actual service delivery, it's an area that we need to interrogate further.
They were planning, the Ministry of Education, to phasing out primary training teacher colleges, PTCs. Yet you're asking for more teachers to enroll, and you're asking them to be degree holders. But you've not provided the requisite resources in terms of salary payment to them.
They have also challenged government to expedite enactment of the National Health Insurance Scheme Bill, which has remained stuck in the corridors of Parliament and Executive to ensure health well-being of Ugandans.
We've seen only about 3.9% of Ugandans can access health insurance. 3.9% of the population of Uganda. And this is alarming, definitely. This means that the other percentage is spending what we call out of pocket on health, which is very critical. We have been engaging government on this discussion, but it's one that has not been expedited. And one of our asks in this meeting was to have the Ministry of Health and Parliament push for this discussion.
Members of the Health Committee who attended the engagement have committed to move the National Health Insurance Service Scheme Bill as a private member's bill as government continues to drag its feet.
We were busy with the public health, which we've concluded on and submitted. So the next on our agenda as the Health Committee is the Health Insurance Bill. Fine, it was worked on by the 10th Parliament, but the President has not yet appended the signature simply because there are some challenges and some clauses that need amending to suit the current situation that we are living in.
Report by Fred Kajubi for the news.